Hello and welcome and very good evening to all of you. Today we are going to be discussing everything about malaria which is important towards exam expect. Every question will be covered, like every line is a question. Most of the questions are covered here, including the previous year papers and very important high yield topics. So let's get started without wasting any much of time. I'm your host, Dr. Smita. Okay, so in history aspect, we need to remember who discovered the parasite and who discovered the transmission of it. So AL, how I remember is AL. Malaria में A and L is quite important. So how I remember. A. Levran is the one who discovered the malaria parasite, whereas transmission was discovered by Sir Ronald Ross. I think everyone remember this one. Malaria month is celebrated in June, whereas Malaria Day is celebrated on 25th of April. Most common species in India is Plasmodium falciparum. Not found in India is Plasmodium ovale. Nolsi in India is only found in Andaman and Nicobar. Moving on, life cycle definitive host, which is primary host, which is sexual host, is Anopheles mosquito. The life cycle is 10 to 12 days. In Anopheles mosquito, the Plasmodium life cycle is 10 to 12 days. Secondary or intermediate host is human, of course, 5 to 7 days life cycle. Stage associated with clinical features, which is fevers, chills, etc., is erythrocytic stage. Relapse is seen in case of ovale. Recrescendent phenomena is seen in case of malaria and falciparum. This one is ovale and vivax. Mosquito cycle is 10 to 12 days, hence fogging is repeated in 10 to 12 days. Now, towards Plasmodium falciparum, the resistance is fetal HB and sickle cell trait. How to remember incubation period of various species of Plasmodium? You will have to remember FXOM, and then you'll have to remember 12, 14, 16 and 28. Instead of 18, you will go 28. F is falciparum, X is vivax, O is ovale, and M is malaria. Black water fever is a complication of falciparum. Diagnosis में gold standard will be blood smear examination. Blood smear examination can be of both type, thick and thin. We do both. Thick is done to see the parasite present or not, and thin is done to see which kind of parasite, like what is the species. The stain used is JSP stain. Now towards the treatment is a little bit tricky. Often it's hard to remember and understand at the first time if you're reading it for the first time, but I have simplified this as much as I could, and this will be very easy for you. So for Plasmodium vivax, what is the treatment regime in India? The drug of choice is CQ3 plus PQ14. This is all you need to remember. CQ3 is what? Chloroquine given for 3 days. The dose is 25 mg per kg distributed over 3 days. That is, day 1 में 10 mg per kg, day 2 में 10 mg per kg, then day 3 में 5 mg per kg. Similarly, PQ14, that is primaquine, given for 14 days. The dosage is 0.25 mg per kg for 14 days. If I am mentioning the doses, that means it has been asked multiple times. That's why you need to remember it. Next is Plasmodium falciparum. In this, we give area dependent ACT. Area dependent ACT में you have not northeastern states and northeastern states. Two are there. So in case this is found, falciparum infection is present in a person who is from not a northeastern state, what you will prescribe is ACT-SP. ACT-SP में it is also a 3-day regime. What you will give? Artesunate, sulfadoxime and pyrimethamine. Now day 1 you will give artesunate, sulfadoxime, pyrimethamine. Day 2 you will give artesunate and single dose of primaquine, which is the dose is 0.75 mg per kg. Day 3 you'll only give artesunate. So that is what happens if it's a not a northeastern state. In case of northeastern state, the regime is changed into ACT-AL, and AL stands for artemether and lumefantrine. In case of a mixed infection, both falciparum and vivax, then what you will give? You will give area dependent ACT, SP or AL depending upon the area, and primaquine at a rate of 0.25 mg per kg for 14 days. Since How to remember it's 0.25 and not 0.75? Since we are giving for 14 days, it cannot be 0.75, it is 0.25. Moving on, contraindications of certain drugs, which is very important. Primaquine. Primaquine का mnemonic मैंने बनाया है PGI, which is pregnancy, G6PD deficiency and infants. ACT-SP is contraindicated, mnemonic 15. First trimester में contraindicated है, less than 5 months of age it is contraindicated. ACT-AL, that is in northeastern states, contraindicated, similar to 1.5. There is one more 5 here, 155. That is first trimester, 5 months of age and less than 5 kg of weight. Next, malaria treatment in pregnancy. Treatment in pregnancy and contraindication in pregnancy is quite common questions in FMG specifically. So please focus. First trimester mein you will give chloroquine 10 mg per kg TDS. In second trimester you will give area sensitive ACT without primaquine, because primaquine is contraindicated in pregnancy, as we have already learned this here. Okay. Now chemoprophylaxis of malaria. Many questions come. One question often comes from chemoprophylaxis. This is also important. So chemoprophylaxis could be a short type or a long type, depending upon your time of travel. So if you're traveling for less than 6 weeks, you should take short one. If you're traveling for more than 6 weeks, you should take the long one. What is the drug of choice in both? Drug of choice in short is also named shortly. ऐसा short सा नाम है doxycycline 100 mg per day. In case of long, you'll have a long name, that is mefloquine 250 mg per week. For how many days? You'll take 28 days post travel, that is 4 weeks post travel, both. So you don't need to remember differently, both का same है. When you will start taking, if you're taking a short trip, you will start shortly, that is 1 to 2 days before. If you're taking a long trip, plan properly and start from before, that is 2 to 3 weeks from travel. Please don't forget that this is per day and this is per week. Okay. Next is protection from the vector. This has a lot of questions. This has a lot of theory, but not that many questions are there. So I have only mentioned the important ones. Bed nets are at a personal level protection and treated with deltamethrin. Mosquito repellent chemical used is DEET. Larvivorous fishes are Gambusia affinis and Poecilia reticulata. Anti-adult methods used is space fogging or residual spray. For space fogging, you use malathion. For residual spray, you use DDT. The residual effect is 6 to 8 weeks in malathion and 12 to 15 weeks in case of DDT. Now, towards the PSM aspect, what is NVBDCP? National Vector Borne Disease Control Program. This is the first program of independent India. What are the targets of this program? There are 4 targets of this program, which includes API, annual parasite incidence. This is not index, this is incidence. Okay, annual parasite incidence should be less than 1 per 1000. ABER, annual blood examination rate. Annual blood examination rate should be more than 10%. Elimination of Kala Azar should be done. Filariasis should be done. When it will be called filariasis ka elimination? When the microfilaria is less than 1%. Control dengue. How you will control dengue? Means decrease the morbidity and mortality of dengue. So these are the 4 targets you need to remember for National Vector-Borne Disease Control Program. What diseases does it include? It includes 6 diseases. Okay, 6, out of which 5 out of 6 is caused by mosquito. So 3 you can easily remember: malaria, dengue, chikungunya. Other is filariasis and Japanese encephalitis. The one which is not caused by, the 6th one which is not caused by a mosquito is Kala Azar, which is caused by sandfly. Please remember, sandfly cannot fly, doesn't fly, it's just the name. Okay, moving on. Classification of state based on API. So there has been classification done based on API. If annual parasite incidence is less than 1, then the state is in elimination phase. If annual parasite is less than 1 in most districts but more than 1 in sub-districts, then it is a pre-elimination phase. If API is more than 1, then it is an intensified malaria control phase. Okay, now international malaria surveillance is done by 3 factors. It is done by 3 methods. 3 things are important for its surveillance. One, we already know, API less than 1 per 1000, which was in our NVB अपना national program में जो था. You can keep revising old things when you come to know the new things. ABER हमें पता है it should be more than 10% in India program में ऐसा है. Now this is new. Child spleen rate. So this is the calculation of splenomegaly in children of age group 2 to 10 years. If CSR is 25 to 40%, then it is an endemic area for malaria. This is also an indicator for disease over a couple of years, because this is having an age range. So you'll know disease over years का क्या status है. Now moving on to the last topic, the vaccination. There is no as such vaccination other than Mosquirix. Mosquirix vaccine is a protein-based vaccine. It is made up of two antigen ka components, one of which is falciparum ka and second of which is hepatitis B ka. So let's read what is written here. This is the strain ka naam. The two components there are. This is the strain ka naam of the vaccine. Okay, so RTS/AS01 is a recombinant protein-based malaria vaccine. It is the only malaria vaccine approved and is wide used. Okay, so route of administration is intramuscular, 0.5 ml given. Target is F. falciparum mainly, and to a lesser extent hepatitis B is also targeted because this antigen is also there, but mainly it's this one. So the main target we are having is this one. So this is all what I felt like ki bahut important hai. Questions have been frequently asked. If you want to summarize and understand malaria in a short way, like considering the medicine and PSM aspect of it, I think this video should be good enough for you. Thank you for watching. Please share, subscribe, and mention what next topic you want me to cover, which is very high yield and which is complicated, you think needs to be summarized. I'll try and do it. I'll try my best to do it, and I'll see you in next video. Thank you so much.